I'm Zeelbert, and today we are going to study about thiazide and thiazide-like diuretics. So, most commonly used diuretics are hydrochlorothiazide, indapamide, chlorothiazide, benzthiazide, and chlorthalidone. This is the structure of hydrochlorothiazide and this is the structure of indapamide. So now, let us focus on the key points of thiazide diuretics. First of all, they are medium efficacy diuretics. Second, site of action is early distal tubule, which is site 3. They act by inhibiting sodium chloride symporter. Then benzothiazide is the parent structure of this class molecules and this is the structure of benzothiazide. The most important thing we should be cautious about is they are not preferred to the patient with diabetes and not preferred to the patient with low GFR, which is low glomerulus filtration rate. And the reason why they are not preferred in those patients is what we will discuss at the end. Now, let us see the mechanism of action of thiazide and thiazide-like diuretics. As discussed earlier, they act by inhibiting sodium and chloride symporter on luminal membrane at early distal tubule. Thus, this inhibits the entry of ions, which is sodium and chloride, into basolateral membrane, and so they are excreted via urine. For better understanding, let's look at the mechanism of action of thiazide diuretics diagrammatically. So this is the diagram of early distal tubule cell, where this side is the luminal membrane, this side is the basolateral membrane. This is the sodium channel symporter on the luminal membrane. This is the sodium potassium ATPase pump on the basolateral membrane. This is the potassium channel and this is the calcium channel. So generally, as you can see, from the urines, ions such as sodium and chloride enters luminal membrane through sodium chloride symporter. Then, sodium enters the basolateral membrane through sodium potassium ATPase pump and chlorine enters basolateral membrane through chlorine channel. So now in the presence of thiazide diuretics, what happens is they inhibit sodium chloride symporter, which inhibits the entry of sodium and chloride into the luminal membrane and thus they are excreted via urine. So now let us look at the indications or therapeutic uses of thiazide or thiazide-like diuretics. There are 4 main indications of thiazide diuretics. The first is edema. They are used in the maintenance therapy for edema. Second is hypertension. As they decreases the amount of ions in the body, they help in hypertension. Third is diabetes insipidus, and the fourth is hypercalciuria because it decreases the excretion of calcium in urine. Let's have a look on the side effects of this class of diuretics. First is hyperkalemia, second is hypomagnesia, third is hypercalcemia, hyperuricemia, hyperglycemia, acute pancreatitis, and lipido. So now, let's answer those 2 questions that why thiazide diuretics are not preferable for the patient with diabetes and low glomerulus filtration rate. So in the case of diabetes, in the patient, what happens in the general case is insulin would reaches the target cell via bloodstream, insulin starts to send signal inside the cell. This increases the amount of glucose transport protein, which brings glucose into the cell, and thus it lowers the blood glucose level. But this glucose transport protein are dependent upon the potassium levels. So since potassium level decreases, the glucose transport protein also decreases, which increases the blood glucose level. And they are not suitable for the patients with low GFR because thiazide diuretics are protein bound and thus they are not filtered from glomerulus. So drug enters tubular fluid via secretion in proximal tubule, which is dependent upon GFR. Thus, if the patient has lower GFR, less amount of drug will be available in the proximal tubular secretion. Thus, less diuretics reaches at the site of action, which definitely shows lower effect of diuretics. For the written update, visit my website www.zealspharmacytutorial.wordpress.com. Thank you.